So first off, could you just give a bit of your own background in oncology?
Sure. So my name is Jennifer Moss. I have a PhD in health behavior. So for about the past 10 years, I have done research into how to prevent cancer incidence and cancer mortality, especially as it relates to geography. So what is it about certain communities that makes people more or less likely to develop cancer and to die from cancer? So a lot of times we're looking at differences in smoking, physical activity, differences in screening behaviors, as well as more environmental factors about the community, the socioeconomic status, access to green space and healthy fruits and vegetables, and other sorts of environmental exposures that give rise to these patterns we see across the whole country, really, in terms of people in different communities being more or less likely to die from cancer in ways that are probably preventable.
So before we jump right into the study, could you sort of explain what a persistent poverty county is?
Sure. So persistent poverty counties are counties where at least 20% of the population lives below the federal poverty level, going back to 1980. So according to the census from 1980, 1990, and 2000, as well as the most recent estimates from the census, the American Community Survey. So basically, we look at a county and see what percent of people living there are below the federal poverty level at that time. And about 400 counties in the US have had high levels of poverty since 1980. And those are the persistent poverty counties that we're interested in. So they're different from counties that are currently experiencing poverty because they've had decades of just not enough socioeconomic investment.
So now, what were the findings of your recent study of persistent poverty counties?
Right, so what we did is we looked at deaths from cancer recently, the last few years, and how the rates of cancer mortality overall and for different cancer types is different for counties that are designated or classified as persistent poverty versus other types of counties. So what we saw is that cancer mortality is about 12% higher in overall cancer mortality is about 12% higher in counties that have experienced persistent poverty than other counties. And the mortality rates for certain subtypes of cancer are particularly striking as well. So lung cancer, colorectal cancer, some of our biggest hitting cancers in the United States are much higher, affecting many more people in these persistent poverty counties. And we also compared the persistent poverty counties to counties that are currently experiencing poverty, high levels of poverty, and even comparing the two different types of impoverished counties, we see much higher rates of cancer mortality in the persistent poverty counties, which really speaks to this constellation of risk factors that are challenging people in these persistent poverty counties from living healthy lives.
So what would you say are the implications of these findings?
Right, so these findings tell us lots of different things. Number one, we need more research as to why we see such high rates of cancer mortality in these counties. You know, I have a lot of hypotheses about what may be driving it, but we really need to get a better insight into the differences between these counties and other counties. And we suspect that it's a lot of factors, right? So environmental exposures, the housing conditions, the air quality, water quality. Do people have access to good education and good jobs? Do they have access to good health insurance so that they can get screening and prevention services and treatment services for those people who do have cancer? as well as some individual behaviors such as smoking, physical activity that are probably different. So we need some research to understand what large-scale processes are in place, as well as individual level behaviors and risk factors to determine what's the best way to intervene to make sure to give people in these counties the opportunity to be healthy. And once we get better insight into the real reasons why these cancer rates are so high, we can start targeting those factors. And that will probably involve a lot of work from the community, from the clinicians in the healthcare system, as well as local and national government and policymakers to put different structures in place so people can be as healthy as possible.
So are there any sort of planned next steps for the study?
Yeah, right now we're continuing to look into this issue of persistent poverty, especially as it relates to rurality and to race and ethnicity. So what we found in this analysis is that counties, and other people have demonstrated this as well, counties that are experiencing persistent poverty tend to be rural, located in the South, and have high concentrations of racial ethnic minorities. So we need to investigate even further into how persistent poverty and rurality, which are county level factors, and race and ethnicity, gender, age, how all of these factors work together to put people more or less at risk for cancer. And that will also help get us insights into the real processes that are driving these disparities, because we can start to see, to get some insight into disinvestment in public health, systemic racism and sexism, and qualities of the healthcare system that could be driving some of these differences. And that's our next step in terms of investigating further into persistent poverty counties and why we see these really high rates of cancer mortality.
So what would you say is most important for practicing oncologists to understand about the study?
Yeah, so a lot of what we need is more healthcare providers in these persistent poverty counties. So people living in these counties may or may not have access to primary care or specialty care. And we know that that's really crucial for accessing screening and treatment and supporting survivorship and quality of life. Oncologists could also be really impactful forming partnerships with other clinicians, with community organizations to help create processes for citizens, for people in these counties to access social services, healthcare services, the tools that they need to be healthy. So I think oncologists are really great leaders in the field. They're very well respected and trusted in their communities. So they would be a really great key to making sure that people in persistent poverty counties can get into the healthcare system and get the help that they need.
So are there any sort of resources that patients in these geographic areas can turn to ensure that they're receiving the care that they need?
Yeah, so the American Cancer Society and the Centers for Disease Control and Prevention, they have services for people in underserved communities to help them access screening and access prevention services. Federally qualified health centers around the United States are really great entry points for people to access care regardless of ability to pay. So certainly there are people in persistent poverty counties, that have good health insurance and good access to care. But for those people who don't, federally qualified health centers or community clinics would be a really great place to learn about services that could be helpful for a given person. And those clinics also tend to have good connections to other community organizations and social services to help deal with prevention, access to fruits and vegetables, in order to deal with those individual level barriers to living a healthy life.
Great. Well, thank you so much. That's all I had for you. Is there anything that I didn't ask that you think is worth mentioning?
Um, let's see. The some of the disparities that we noticed for people living in persistent poverty counties, some of them have a very clear behavioral cause, such as smoking. And it's important for everyone who's smoking to quit smoking as soon as possible. And whether that's with the assistance of healthcare services or community organizations or not. Other cancers that we saw have really good screening tests to detect them at an early stage. So again, it's important for people to access those healthcare services in order to get screened as appropriate. But we also need larger investment from policymakers, local, state, and national policymakers. So I encourage people in persistent poverty counties, but people everywhere who care about health equity, to vote, to talk to your elected representatives, and make sure that we can target these counties to improve health, improve socioeconomic conditions, and improve environmental conditions, so that we don't see this unfair distribution and burden of cancer on people who just happen to live in these counties that are experiencing persistent poverty.
Absolutely. Well, thank you so much for taking the time to speak with me. I really do appreciate it.
Yeah, no problem. This was great.